1 week after Ballad Health revealed plans for the creation of a comprehensive regional trauma and emergency care system, community members and healthcare workers continue to express some concern about those changes. Good evening, I'm Sarah Diamond.
And I'm Josh Smith. Ballad Health said it will designate Johnson City Medical Center as its only Level 1 trauma center in the region in an effort to streamline care and reduce duplication of services. Level 1's the top designation for trauma care. Holston Valley Medical Center and Bristol Regional Medical Center will serve as Level 3 trauma centers. According to the state health department, currently the Tri-Cities is the only area in Tennessee to have 2 Level 1 trauma centers. You can see there is only one in the Knoxville, Chattanooga, Nashville, and Memphis areas.
Although both Holston Valley and Bristol Regional will receive new children's emergency rooms, a petition on change.org is nearing 16,000 signatures to save Holston Valley's neonatal intensive care unit and Level 1 trauma center. Caroline Corrigan spoke with both emergency personnel who, despite answers from Ballad Health, still aren't convinced.
And Caroline, Ballad Health leaders stress treatment of critical care patients is their top priority.
Josh, Sarah, with the Johnson City Medical Center providing the only Level 1 trauma center in the region, emergency officials tell me they worry this will put a strain on getting patients the care they need when minutes matter the most. For people in Sullivan County,
it's kind of scary to think about.
Ballad Health's decision to change the way they handle trauma came as a concern. Next year, Johnson City Medical Center will be the only Level 1 trauma center in our region, which means patients experiencing extreme trauma will be sent to Johnson City.
You're talking another 20 minutes, regardless, anywhere to a facility that you could get medical treatments.
And she's not the only one. Nearly 16,000 people signed a petition on change.org to keep Holston Valley's neonatal intensive care unit and Level 1 trauma center.
I think that it's absolutely critically important that the people in our region have an opportunity to truly understand what's at risk here.
Medical Director for Fire and Rescue in Kingsport, Dr. Mickey Spivey, who worked as an emergency physician for 30 years, believes the lack of Level 1 trauma care in Sullivan County will come at a price.
Not only does that increase risk from patient travel, delays patient access to timely care, which is crucial in trauma care, but it also takes a valuable EMS resource out of the picture for an extended period of time.
But Dr. George Testerman, Ballad Health's Vice President of Trauma and Emergency Medical Services, disagrees.
We will know who is critically injured and who needs a Level 1 trauma center. Those patients will be expeditiously transferred by air, medical evacuation helicopter, or an EMS ambulance, and will get there in plenty of time to take care of their problems.
Last week, the Sullivan County Commission passed a resolution opposing these changes, and I'm told the city of Kingsport and Hawkins County plan to discuss these changes as well. Josh?
Caroline Corrigan in our downtown Kingsport newsroom tonight. Thank you.